hope you've had a good week and that you are gearing up towards the weekend and you are doing well. I hope you're feeling well, staying safe, and making sure that those around you that care for you, that they know that you care for them too. Okay, so we have some great questions in for this week's session, so let's get going with those. The first question. Over the years, I've noticed that when I am stressed, my body reacts with pain in different areas of my back. I've gotten really good at knowing what type of pain it is, depending on where it presents in my back. Is this something that I have to live with, or is there something I can do to release the pain? So this to me sounds like you're talking about psychosomatic pain, which of course means that when we are psycho-emotionally stressed out or overwhelmed or unable to handle something, that we begin to get physiological pain as almost like an extension of the symptom of the psycho-emotional feeling of not having a sense of well-being. So I think it's great that you've noticed this, that there's a pattern that, you know, when you have different kinds of stresses, it's showing up in different parts of your body. What I call this psychosomatic pain is cellular memory, or negative cellular memory, or traumatic cellular memory. Basically meaning that we store memories of all kinds of memories, good and bad memories, but in this particular case, memories of trauma in our bodies. And just like your brain stores memory, your physiology can store memory. I think especially INFPs can relate to this, because you have the historian in your 10-year-old position, and the historian is all about storing past situations in the library of your body. So that is particularly true for INFPs. But INFJs also have can have this sense of psychosomatic pain and traumatic cellular memory. You were asking if it's something that you have to live with, or if there's something you can do to release the pain. The cellular memory trauma or traumatic cellular memory can actually be released, but it takes consciousness through movement. So, for example, let's just say that you're in a situation where somebody triggers you to be angry, and you can't feel anger, but you can start feeling your back hurting in a very particular place. Some people get sinus problems, some people get sore throats, some people get liver situations for anger. What you can do in those situations to release that is remove yourself from that situation, so you're in a safe space where nobody's going to challenge what your experience is, because most people probably won't even ever hear about traumatic cellular memory, or any kind of cellular memory for that matter. But remove yourself from that situation, go to a safe space where you yourself will not be challenged in the exercise that you're doing. Write down things that are angering you, that sense of anger, and anything else that kind of works with it. So if you have a sense of I'm not allowed to get angry and I'm so sick of it, I can't handle this, I'm feeling lonely with this, whatever feelings you have coming up, just write those feelings down. And then, unless you're sick or injured, or you have a specific kind of disability, you need to work around this. But I'm talking about just go and walk it off. So go in the nature or on the street or wherever, take some space and go and really get into the feelings of anger as you're walking, as you're marching along, as you're making a statement that you are in fact releasing this painful part of this pattern, but also a painful part of your physical ill-being. Oh, excuse me. So with that, just just try and locate, as you're thinking those thoughts of anger, try and locate where the pain is exactly in your body. Try to pinpoint the epicenter of it. You can even, if you can reach it, you can even try and touch it, to give it physiological representation that, yeah, you know what, it's right there, I can feel it. And when you acknowledge it that way, it starts, the epicenter starts to relax, and the tissue, the cellular, the muscular cells, which can hold on to that cellular memory trauma, start to open up. The muscle fibers, there are these filaments in the muscle fibers that, when the muscle contracts, they kind of slide within each other, and when the muscle stretches, they slide away from each other. And that's how actually muscle works. So when I do this, that's what the filaments do. They, go together, or they stretch out. And so we want to get to a point where, in your muscular fiber, you have a traumatic cellular memory that keeps it stuck. So it doesn't get to glide. So there might be a little bit of movement, but it doesn't glide as it would normally. And we want to identify it. And those of you who know about pressure point or acupressure therapy or acupuncture, you understand what I'm meaning. There's like an energetic version of it in those cases, but also a physiological space where you introduce awareness into that area, which then allows, it acknowledges what's sitting there, and it allows a little bit more movement to start getting in there. And the reason why it's so important to kind of recognize it, acknowledge it, see exactly where it is, and then give it wording, give it like, the wording that you are writing down and you're thinking about. When you give it those things, that traumatic cellular memory is like a bunch of tissue that's clamped together, and when you give it that voice, it starts opening up. And what comes out of that, whatever has been in that kind of clump of stagnation and pain, physiological pain as well sometimes, is the release. Blood flow gets back in there, lymph flow gets back into that area, that part of your body, and also psycho-emotionally, whatever was the fear that was causing that cellular piece to react in that protective way is exposed. And you'll find out a lot about yourself and fears that you might have and the pain points that you might have by doing this exercise. So, no, you don't have to live with it, but also what I'm describing may not be something that you can just do all of a sudden. It takes practice, and it takes a lot of awareness and understanding of physiology, anatomy, physiology, and kinesiology, as well as just allowing yourself to immerse yourself in your inner parenting journey. So if you need some help with that, you can just reach out to us at desk@infxproject.com. And I'll put you in touch with the qualified integration mentor that can help you with some of that work. But you don't have to live with it for the rest of your life. But the challenge is that if it's really chronic, it can be really hard for you to break it on your own. So, if you try and go and break that cellular traumatic memory on your own and it doesn't work, don't think it means that it can't be resolved. It can be resolved. It's just that if you have a lot of mileage and attachment to that pain, it's possible that you won't be able to do it on your own. And this was something that, I had for many, many years. I couldn't do it. I was too close to it. So I got help with other people who understand the concept and can help me with it. And with their help, I was able to release a lot of that cellular memory from my experience as well. So I hope that answers that question. And I look forward to hearing your reflections on that answer.